in general, and then we'll talk about the teaching chapter and then the evaluating chapter. The State Board of Nursing requires nursing programs to have a certain number of clinical hours in their curriculum. And in the SNU curriculum, currently we require 677 hours of clinical experience. And if you do the math on that, if you divide it by 8 hours, that's about 85 days. I know some schools are doing 12-hour clinical shifts, but we still are with the 8-hour shifts. And as you know, sometimes they can't do 8-hour shifts, like in a nursing home facility. You know, it might be a little bit shorter time frame with community health. So a significant part of the nursing curriculum is based upon this clinical experience, and so we want it to be effective for them. There has been discussion for at least the past 2 years, maybe 3, of substituting the human patient simulator hours for clinical hours. As of date, unless they've changed within just the last few weeks, the State Board has not accepted those as substitutions. And so we're still, busy trying to get our clinical placements for our students every year. There's an organization called NESA, and I can't remember what that acronym is for. Do you remember, Laura? It's like Nursing Education Something Association. It's the group of educators, a representative from each school comes, and then you select your clinical placements. They meet 4 times a year, December, February, June, and August, and it's how everybody negotiates for their clinical spots, primarily in hospitals. So,
clinical hub too is what they
clinical hub is clinical hub is the term that's used in the school nursing handbook. And so that's so important because your school has to be represented, and you have to have those clinical opportunities for your students. A formal agreement is signed between the School of Nursing and the agency, and there are forms for that. If you are ever involved with that, schools have developed their own, and then there are standardized forms as well. And then we also have the job of preparing our students to go into clinical settings. And so I posted our current student handbook for you all. And if you look at pages 31 to 34, I don't know if you, sorry, I'll pull this up for you. I think the cupcake stuck in my throat. But it was good. It's taking a long way to get there. So, okay, so in preparing students for clinical practice, they have to have certain immunizations, and sorry, this is freezing up. Well, sorry. If you can open, that handbook, it's on page 31 to 34, and I've actually printed that out for me to talk with you about. But the areas that are important are immunizations. They have to be certified for CPR with both adult and child, with 2-person and 1-person. Drug screening, OSBI, background check, and they have to have review HIPAA requirements, universal precautions, restraints, fire safety, TB, cultural diversity, and sexual harassment. So they have to have a lot of preliminary completed before they go out. And then there's a chart for the different immunizations and how that they can show proof of those. And I thought it was interesting, if you had shingles and can document that medically, you don't have to show that you had chickenpox vaccination. Okay, I mean, I know they're related. Okay, the areas that I thought are interesting for our campus have to do with the dress code. We have a uniform that all of our clinical students wear. Excuse me, I thought it was just the room in the science building. And so, thanks. So that is the uniform. They may wear a plain white short sleeve or long sleeve t-shirt underneath. So that's acceptable. What do your students wear, Lori? Same thing?
Mm-hmm. Ours is like Southern Nazarene's certain color.
Ours are maroon.
Ours are Smurf blue.
Smurf blue, okay. All right. Hair has to be neatly arranged away from their face and off their collar. If the guys have a beard, it has to be neat and clean. Jewelry, we're pretty particular on jewelry. Can't have any ear stretchers, tunnels, nose, lip, tongue, and eyebrow studs or rings. So that's pretty standard. That's pretty standard. When I go out, I don't see anybody wearing those things. Their tattoos must be covered. And they wear a name badge with their picture. Everybody's used to that now. Their shoes have to be clean and white. They can't have any open-toed shoes, of course. And then they wear a lab coat. And our students are not allowed to wear denim, even if they're out in a clinical setting. They can't wear denim, and they always wear their lab coat. And then they're supposed to avoid perfumes and those kinds of things, no chewing gum. And we used to have a rule that you could not wear any type of nail polish, but now we allow our students to wear clear. So that's a little bit of a change.
Nails forbidden from wearing ties.
I didn't say anything about
ties.
germ-carrying ties. Ours didn't say anything about ties. Yeah, that's a good point. So, well, if they're wearing their scrubs and their t-shirt, I guess that wouldn't be a factor. So, okay, so we've got to get those students ready. And I've heard our School of Nursing chair say more than once, it takes forever to get them all ready with everything they have to do before they go out. You know, and it's like you've got to do it, or you can't go out on clinicals. But it takes a lot to get them done. And we've also started building in like the background check fee. We build that into their course fees, because that was a problem as well. Well, I don't have $25 to go get my background check done. You know, so okay, so we roll that into their fees as well. Okay. So in Chapter 18, let's talk about what happens in the clinical setting. And you all have been around students in clinicals. What are some of the biggest challenges for clinical educators? What do you think some of the biggest challenges would be?
One is getting a nurse on the floor that wants to teach them to work with them.
Okay, not every nurse wants to work with them. Okay.
Not every patient will allow a student.
Okay, that's right.
You can refuse a student?
Oh,
absolutely. Yes.
Unless you're in OU.
We can refuse a nurse.
You refuse a nurse. We were no kidding.
I think a lot of it has to do with the nurses wanting the students as well. I know, like, I worked in the ICU at Crosby, and we had so many nurses who would not let the students participate. And I don't know, I mean, I always had, like, 4 students.
Because you were nice to
I always had 4.
Okay.
It was
What else, Stan? What's another challenge?
One of the things, well, it's not really a challenge,
Oh.
but one of the things that we've always noticed in the OR after patients have gone sick, they have a student, sometimes the nurse will ask, have you ever put a Foley in? And invariably, every one of them will say no. So it's like, come over here and we'll show you.
Show you how.
Because it's like,
But you do have something there.
yeah, I mean, nurses right now, I'll put a Foley in.
They aren't allowed to do that in OR. All they're allowed to do is observe, because we're not back there as their instructor. It's just an observation, because we can't both go back there.
Okay.
We don't have to
All right.
in, but
Any other challenges you can think of for clinical educators? Let's think for what we've talked about. Challenges for nurses who are working in the facility, but what are some challenges for the nurse educators?
To get the student to engage and get out there and do it.
And talk to them.
Talk to them.
Talk to patients. They're so reticent. Okay.
Well, I think we talked about this before, but with the short stays nowadays, just getting the patients that they need for the
Mhm.
educational
Right.
instruction.
Right. Our clinical faculty used to go the night before clinicals to select the patients for the students to work with. And they quit doing that. They go the morning of because of the short stay, short like you're talking about, Chloe. So it was really an advantage when they could go before, because then they could kind of let the students prep and get some work done on if they were needing to do some research on the disease process or whatever for that patient, and that's just not happening.
Now we try to
Before.
make sure we can give them a patient that's going to be there. If we have a 2-day clinical,
Uh-huh.
it's going to be there both days.
Mhm.
Because invariably I will take 8 students on a clinical,
Mhm.
and half of them will have to have another patient for their second clinical,
Yeah.
which means double the work. They have to do pathophys on
Mhm.
both patients' disease and all that stuff. You feel bad, but sometimes you don't.
Right.
have
It's
to.
part of the system that you can't manipulate. So.
Yeah.
Mhm. Okay. So challenges on both sides for the nurse educator, for the nurses who are agreeing, if they will, to be the preceptors or mentors for the day, and then also for the students as well, because they are they have issues that they come with as well, and so lots of things going on. But there's a text box on page 318 that I think is excellent. It gives you questions to help guide clinical experiences, and it follows Bloom's taxonomy. So I think that's a really helpful box there. So you can ask students again, for example, what is your reason for thinking that? Can you explain to me how you made that decision? Not in a way to make them defensive, but in a way to help them learn. So I really like that text box. And then this chapter also talked about preclinical, midclinical, and post-clinical conferences. What are some teaching learning strategies that you might use, especially in a mid-clinical or post-clinical conference? Some of the things we've already talked about the last couple weeks and even this evening. What could you use? Teaching learning strategies in the clinical conferences.
When you're doing debriefing,
Debriefing, okay. What would you do in that debriefing, Sherry?
just kind of letting them reflect back on the learning experiences, or if they
Okay.
have any questions about what
Okay.
happened. Or
Okay.
A lot of times if something traumatic happened, it's a good time just to reflect on
Mhm.
that and kind
Okay.
of decompress.
Okay. So you all have written questions for discussion in a classroom setting, but you could also be using questions in that debriefing session as well. Okay. Because we have to make those connections for students.
Right.
It's not like, oh, check off my clinicals for today. It's like, what did I learn from these clinicals?
You can
Okay.
even have them go and journal
Okay, journaling.
that,
Good.
that evening, while it's fresh.
Okay, what else? Another strategy you can think of.
We go around the room in our post-clinical, and I ask them the questions I ask is, what skills did you get to do? How did you feel before and after? What was different from what you understood already? It was going to be an example. You learned in class, you read in your book that it should be this way, and this way. Do you feel like it followed that process, for instance? See, how'd you think? What'd you feel? And then what was your reaction to the way the experienced nurse handled the situation, if they were in there with you, or if you were just observing something?
Okay.
And then because sometimes, they come out of thinking that the nurse was rude or mean or, something to that effect. And granted, sometimes they are, but you have to kind of walk through those and remind them, we're guests in their house, so to speak. And so try to not really disillusion. I don't know. Sometimes nurses just, they take shortcuts and stuff. And it may not be wrong, but it's not the way that they're learning it in the book. And so you have to try to
Reconcile that.
reconcile the difference for the student.
Okay.
Yeah.
And after doing it for 23 years, sometimes you're somewhat jaded.
Mhm.
I mean, that happens.
It does.
And it just,
Yeah.
doesn't mean they're a bad nurse, but it just does happen.
Mhm.
And it's hard for a brand new nurse or a student that's gonna be a brand new nurse, they're like taken back by that. They're like, well, I mean, it's hard.
We have
Okay.
one nurse that they always seem like they get paired up with, and the students have nicknamed her Sour Sarah. And she's a good nurse, clinically skills, but she does come across as real sour.
Yeah.
And I mean,
What do you do?
you know,
Right.
and so, you know, it's, yeah.
There's sour.
We
Well,
got
yeah.
Sour Sarah
Sour
today.
Sarah.
So some of the things are using questioning, whether it's on the part of the faculty member or the students, and then using journaling, okay? I've been in post-clinicals where we've had a speaker, like we had a nurse in ICU who talked about caring, wound care for PICC lines, and she did a special presentation on that at the end of clinicals for us. I've seen where they've had a journal article that they would have read before they came to clinicals, with the faculty member concentrating on a specific area that evening, and then they would talk about that. So, you know, some different ways of thinking about having variety in those clinical, mid-clinical and post-clinical conferences. And I've been in on both, not so much on the mid. The mid is usually when they go down to eat lunch or dinner, and then they talk about, oh, this was really hard tonight, or, you know, those kinds of things, kind of more informal, and then the more formal was then at the end of clinicals that evening. And then the other place that I just wanted to real quickly look at is chapter 27 on page 488. There's another table, and you know, it's not that the narrative part isn't good in here, but these were just rich chapters with lots of good information. But there on page 488, you'll see a table that lists some, get there for the title for you. Oh, I told you the wrong page. Oopsie. It's 27.1, sorry. It's on page 486. I wrote the wrong number in my notes. Page 486. And it's quick tips for clinical evaluation. And I thought that was a real helpful little table as well. And one other part that I really liked in this chapter, remember last week when we talked about experiential learning, and the 6th step in that cycle is to let the students give you feedback on how the simulation or the activity worked. Well, there's also a place toward the end of that chapter, I think it's page 497 if I wrote the right number down for that page, that gives students an opportunity to evaluate the clinical setting. And I think that could be a valuable tool in getting feedback from them about how things went. It could be at the end of the semester so that you know if you want to send more students there later. And I've only been on one clinical assignment where it was not a comfortable situation for our students. It was down at OU. It was before the Women's and Children's Hospital was redone, and it was just the old OU hospital down there. And so we, you know, kind of steered away from sending students down there for a while because we had just gotten enough feedback that it just wasn't the good fit. And we got enough feedback from students about that. So anyway, I thought that was kind of an unusual piece to this whole clinical evaluation aspect. Okay?
I love that sandwich thing they talked about.
Yes.
That
Yes.
to me was real eye-opening. I like
Yeah.
that.
Like I said, both of these chapters I felt were just had lots and lots of really good information in them. So, okay, that wraps up my part. And Stan, if you would just turn that off, thank you. And